venous return. We have the superior vena cava, we have the inferior vena cava, and we have the coronary sinus. These three vessels are draining into the right atrium. Right atrium receives the venous return, and blood flows through, on the right side, the tricuspid valve. So here's the cusp of the valve. Here's the chordae tendineae, and here are the papillary muscles. Now, only in the right ventricle do you have this moderator band right here. You can stick your finger in the moderator band right there. Now, in the atrium, you have these muscular ridges that are the pectinate muscles, and in the ventricle, you have the trabecular muscles. They have a more rougher appearance than the smoother atrium. Once blood flows into the ventricle and it's full, what is that called? When the ventricle is full of blood, what volume is that? Right. That'd be a good test question, and I don't ask it on the lecture. I have to think about that next time around. But yeah, so you have the end diastolic volume here, and then as this contracts, blood will be forced through the pulmonary trunk here. So inside the right ventricle, this is the right ventricle, this is the right ventricle, is the pulmonary semilunar valve. Right, this is the pulmonary semilunar valve inside the right ventricle, and leading up to it is called the conus arteriosum. It's the funnel-shaped area leading up to the pulmonary semilunar valve. Conus arteriosum, pulmonary semilunar valve. So blood enters through the pulmonary semilunar valve into the pulmonary trunk, where blood flows by way of the right pulmonary arteries, taking blood away from the heart, even though they're blue and deoxygenated, they're leaving the heart, and also the left pulmonary artery. Now blood's going to go and circulate around the alveoli through the capillaries and return back to the heart, oxygenated, and return by way of the left pulmonary veins. By definition, blood is returned back to the heart by veins and right pulmonary veins. Now, because we have symmetry, right atrium, right ventricle, left ventricle, if I have this sitting on the countertop like this and I ask you to identify this chamber, you're going to have to tell me if it's either the right atrium or the left. If you don't tell me that, and you just tell me atrium, that would be wrong, because there's two of them. If you forget to flip it around because you're looking at it from the anterior view, if you turn it around from the posterior view, everything on the right is right and everything on the left is left. So, once inside the lungs, the red cells are oxygenated and returned back to the heart, as we said, by way of the pulmonary veins here in blue, left and right pulmonary veins into the left atrium. The left atrium is where you find the bicuspid or mitral valve, which is also connected to chordae tendineae and papillary muscles, and also you can see the trabecular muscles. Now, the distinction between the left ventricle and the right is the thick medial wall compared to the right medial wall of the right ventricle. So that's telling us that the pressure inside this chamber is much higher as it pumps blood throughout the systemic circuit. When blood pressure rises in the left ventricle, it travels through the aortic semilunar valve here, into the ascending aorta, into the arch of the aorta, and then into the descending aorta. Now, in the aorta, just above the valve, you have the opening to the right coronary artery, opening to the left coronary artery, and then three major vessels coming off of the arch. So here's the arch, brachiocephalic trunk, left common carotid, and left subclavian. Three major vessels coming off of the arch, with this being the ascending, this being the descending. Now, as blood enters into the aorta, it's going to expand and recoil. The valve is going to close, preventing blood from flowing back into the left ventricle, forcing blood to the opening of the right coronary artery and the left coronary artery. Let's take a look at the coronary arteries. On the right side, in red, this is the right coronary artery that splits at this area to become the marginal branch and the posterior branch, which is going to course around the back towards the posterior interventricular sulcus. Just as a comparison, this is the anterior interventricular sulcus, this indentation, this sulcus, which is where the left anterior descending and great cardiac veins sit. You can see the fat has been cut away, exposing the blood vessel. Again, the right coronary artery splits into the posterior branch and marginal branch, and the left coronary artery here splits right here into the left anterior descending in red. This is the diagonal artery in red, and this, coming up underneath the auricle, is the circumflex in red. So the circumflex is going to come around the backside here and supply the posterior ventricular wall. Now, blood needs to return from the myocardium by way of the coronary veins. So this blue vein here is the great cardiac vein. On the right side are the anterior cardiac veins that drain directly into the right atrium. It's part of the venous return. If we follow the great cardiac vein around the back, along with the circumflex, it drains into the coronary sinus. The coronary sinus receives blood from the great cardiac vein, posterior cardiac vein, middle cardiac vein, small cardiac vein, PMS. And that returns into the coronary sinus, which returns blood right back into the right atrium. So that's the complete flow of blood through the heart. Valves, right side. Tricuspid, left side. Bicuspid. Separating the right ventricle from the pulmonary trunk is the pulmonary semilunar valve, inside here. Separating the left ventricle from the aorta is the aortic semilunar valve. The top part, flat, where you have the major vessels, superior vena cava. Aorta, pulmonary trunk, is the base of the heart. At the apex, where both of the ventricles meet, is the bottom part, the pointed part that points towards your left hip on an oblique angle. This depression here, where you can see the right coronary artery sitting, is called the coronary sulcus. This is the interventricular sulcus, and what that's telling me that anteriorly, during a gross anatomy, I can determine where the interventricular septum is, which is right underneath the interventricular sulcus. Over here, the coronary sulcus is going around the heart, separating the atrium, the top part of the heart, from the ventricle, the inferior part of the heart. This is the SA node. This is the pacemaker. Impulses travel through the intranodal system, through the atrium, down to the AV bundle, atrial ventricular. From the atrial ventricular bundle to the bundle of His. So at this time now, the atrium has contracted, topping off the ventricles. Impulses travel down the right bundle branch to terminate in the Purkinje fibers, and similarly on the left side, that's going to result in depolarization of the myocytes, papillary muscles. They will pull on the tendons to hold the cusp tight. As these chambers get smaller and the pressure rises, isovolumetric contraction, once the pressure is high enough, that forces the aortic semilunar valve open, the pulmonary semilunar valve open, and ejects about 70 to 80 milliliters of blood, which is known as the stroke volume. Stroke volume times the heart rate, 75 beats per minute, is the cardiac output. Cardiac output every minute, stroke volume every contraction, every 0.8 of a second. Now, in utero, the baby has to circumvent pushing blood into the pulmonary circuit because the lungs aren't working. So this oval depression here is called the fossa ovale. Fossa ovale. When blood is coming back by way of the fetal vein, it goes through the atrium into the fossa ovale, which goes right into the left atrium. And of course, that allows blood to pass the right ventricle, which is pumping blood into the pulmonary trunk. In addition, you have, this is the ligamentum arteriosum, which is the ductus arteriosum in utero. That is open in the, when the baby is in utero. That allows blood to be shunted from the pulmonary trunk into the aorta. So both of those allow for passage of blood from the pulmonary trunk back into the aorta, bypassing the pulmonary circuit. When the baby is born, this flap is going to close, forming the fossa ovale, and this is going to become fibrous, forming the ligamentum arteriosum. And I think that's everything on your list. For sure. All right, so the next thing to do is